A heart attack, medically termed a myocardial infarction, MI, is a serious and potentially life-threatening event that occurs when blood flow to a part of the heart is blocked for a prolonged period. This blockage deprives the heart muscle of oxygen and nutrients, leading to damage or death of the heart tissue. Understanding the underlying mechanisms, risk factors, symptoms, diagnosis, and treatment of heart attacks is crucial for prevention and timely intervention. Imagine the tireless work of your heart, suddenly facing an interruption in its vital blood supply. What happens in that critical moment, and what does science tell us about preventing and responding to this event? Join me as we delve into the intricate details of a heart attack, exploring its scientific underpinnings. Meet Ravi. Ravi was a 58-year-old who led a busy life. He occasionally experienced chest discomfort but often dismissed it as indigestion. One evening, the discomfort intensified, accompanied by sweating and shortness of breath. His wife insisted on calling for help, suspecting something serious. Ravi's experience underscores a critical point. Recognizing the signs and symptoms of a heart attack and acting quickly can be life-saving. The science of a heart attack, blood flow interruption at its core. A heart attack is a vascular event. The heart muscle, myocardium, needs a constant supply of oxygen-rich blood to function. This blood is delivered through the coronary arteries that lie on the surface of the heart. A heart attack typically occurs when one or more of these arteries become blocked. The most common cause of this blockage is the buildup of fatty deposits, plaque, in the walls of the coronary arteries, a process called atherosclerosis. If a plaque ruptures, a blood clot can form at the site of the rupture, suddenly blocking blood flow. Less commonly, a heart attack can occur due to a spasm of a coronary artery that cuts off blood flow. Isn't it a stark reminder of the fragility of our circulatory system, where a sudden blockage in a vital artery can have such profound consequences? Risk factors for heart attack. Understanding predisposition. Scientific studies have identified numerous factors that can increase the risk of developing the underlying coronary artery disease that often leads to a heart attack. Age. The risk increases with age. Sex. Men generally have a higher risk earlier in life, but the risk for women increases after menopause. Family history. Having a close relative who had a heart attack at an early age increases your risk. High cholesterol. High levels of LDL, bad cholesterol, contribute to plaque formation. High blood pressure, hypertension, damages blood vessels, making them more prone to plaque buildup. Smoking damages blood vessels and increases the risk of blood clots. Diabetes increases the risk of atherosclerosis. Obesity, often associated with other risk factors like high cholesterol and high blood pressure. Physical inactivity, a sedentary lifestyle increases the risk. Stress, chronic stress may contribute to heart disease. Ravi had several of these risk factors, including a family history of heart disease and a history of high cholesterol, which he wasn't consistently managing. Recognizing these risk factors empowers individuals to make lifestyle changes and work with their healthcare providers to mitigate their risk. Symptoms of a heart attack. Recognizing the warning signs. The symptoms of a heart attack can vary from person to person, and they may not always be sudden or severe. It's crucial to be aware of the common warning signs. Chest pain or discomfort, often described as pressure, tightness, squeezing, or aching. It may be mild or severe and can come and go. Pain radiating to other areas, such as the arm, often the left, jaw, neck, back, or stomach. Shortness of breath may occur with or without chest pain. Sweating, often a cold sweat. Nausea or vomiting. Lightheadedness or dizziness. Unusual fatigue. It's important to note that women may experience some of these symptoms differently, and may be more likely to have shortness of breath, nausea, vomiting, and back or jaw pain. Ravi experienced chest tightness, radiating pain down his left arm, and significant sweating, prompting his wife to act quickly. The science behind the symptoms. The chest pain arises from the heart muscle not receiving enough oxygen, ischemia. The radiating pain occurs because the nerves supplying the heart can also send signals to other areas of the body. Shortness of breath happens because the weakened heart may not pump blood effectively, leading to fluid buildup in the lungs. Sweating, nausea, and lightheadedness are often due to the body's stress response to the event. Isn't it a complex interplay of physiological responses that manifests as the various symptoms of a heart attack? What to do if you suspect a heart attack? Immediate action time is critical during a heart attack. The longer the heart muscle is deprived of oxygen, the greater the damage. If you or someone you know experiences symptoms of a heart attack, call for emergency medical help immediately. In many regions, this is 112 or 911. Chew and swallow an aspirin, if recommended by your doctor and you are not allergic. Aspirin can help prevent further blood clotting. Remain calm and rest. Ravi's wife's prompt action in calling for emergency services was crucial. If you experience heart attack symptoms, don't delay. Immediate medical attention can significantly improve outcomes. Diagnosis of a heart attack. Confirming the event when someone arrives at the hospital with suspected heart attack symptoms. Doctors will perform several tests to confirm the diagnosis. Electrocardiogram, ECG or EKG, measures the electrical activity of the heart and can often show if a heart attack is occurring or has occurred. Blood tests measure cardiac enzymes, such as troponin, which are released into the blood when heart muscle is damaged. Echocardiogram uses sound waves to create an image of the heart and can assess its function. Coronary angiography, a procedure where a catheter is inserted into a blood vessel and guided to the heart. Dye is injected, and X-rays are taken to see if the coronary arteries are blocked. Ravi's ECG showed changes consistent with a heart attack, and his blood tests revealed elevated troponin levels, confirming the diagnosis. He underwent a coronary angiogram to identify the blocked artery. Treatment of a heart attack. Restoring blood flow. The primary goal of heart attack treatment is to restore blood flow to the blocked artery as quickly as possible. This can be achieved through medications, aspirin, to prevent further clotting, nitroglycerin, to widen blood vessels, thrombolytics, clot busters, medications given intravenously to dissolve blood clots, if PCI is not immediately available. Percutaneous coronary intervention, PCI, a minimally invasive procedure where a catheter with a balloon and stent is inserted into the blocked artery. The balloon is inflated to open the artery, and a stent, a small mesh tube, is often placed to keep it open. Coronary artery bypass grafting, CABG, open heart surgery where a healthy blood vessel from another part of the body is used to bypass the blocked coronary artery. Ravi underwent PCI. The cardiologist found a significant blockage in one of his coronary arteries, which was opened with a balloon and a stent was placed to restore blood flow. The science behind the treatments. Thrombolytics work by activating the body's natural clot-dissolving mechanisms. PCI physically opens the blocked artery, and stents provide structural support to keep it open. CABG provides an alternative route for blood to reach the heart muscle, bypassing the blockage. Isn't it a testament to medical advancements that we have such sophisticated ways to intervene during a life-threatening event like a heart attack? Recovery after a heart attack. Cardiac rehabilitation after the immediate treatment. Recovery involves cardiac rehabilitation, which is a program designed to help patients regain their strength, learn about heart-healthy living, and reduce their risk of future heart problems. This typically includes supervised exercise, education on diet, medications, and lifestyle changes, emotional support. Ravi participated in a cardiac rehabilitation program after his heart attack, which helped him gradually return to his daily activities and adopt healthier habits. If you've had a heart attack, actively participate in cardiac rehabilitation to improve your recovery and long-term heart health. Preventing heart attacks. Lifestyle and medical management. Preventing a heart attack involves addressing the risk factors. Maintain a healthy diet, low in saturated and trans fats, cholesterol, and sodium, rich in fruits, vegetables, and whole grains. Engage in regular physical activity. Maintain a healthy weight. Don't smoke. Manage high blood pressure, high cholesterol, and diabetes. Manage stress. Take prescribed medications as directed. Ravi made significant lifestyle changes after his heart attack, focusing on a healthier diet, regular exercise, and managing his cholesterol with medication. Final thoughts on heart attack. A critical medical event. A heart attack is a serious condition resulting from a blockage of blood flow to the heart muscle. Recognizing the symptoms, acting quickly, and receiving timely medical intervention are crucial for survival and minimizing heart damage. Understanding the risk factors and adopting a heart-healthy lifestyle are essential for prevention. Ravi's experience highlights the importance of awareness, prompt action, and long-term management. Summarized conclusion. A heart attack, myocardial infarction, occurs due to a blockage of blood flow to the heart muscle, most commonly from a blood clot forming on atherosclerotic plaque. Risk factors include age, sex, family history, high cholesterol, high blood pressure, smoking, diabetes, obesity, inactivity, and stress. Symptoms can include chest pain, radiating pain, shortness of breath, sweating, nausea, and fatigue. Immediate action involves calling for help and possibly taking aspirin. Diagnosis involves ECG, blood tests, and angiography. Treatment aims to restore blood flow through medications, thrombolytics, PCI, stenting, or CABG. Recovery includes cardiac rehabilitation. Prevention focuses on a healthy lifestyle and managing risk factors.